Thank you, Shirley, for that nice introduction. I'm honored to have the opportunity to speak to you today. My name is Jake Monroe. I'm a PhD student in the Department of Health and Kinesiology. My research centers on the pathophysiology and how we can alter that of peripheral artery disease. So peripheral artery disease is an occlusive disorder which typically affects the peripheral limbs, mainly the popliteal and femoral arteries in the lower leg. This involves a blockage of the artery supplying the lower leg, which causes an insufficient oxygen delivery to the working muscles for walking and doing other ambulatory activities. This affects over 200 million people worldwide and over 10% of the population that's 65 and older. So you can see here we have what I'm talking about here. This is an example of an occlusion of the popliteal artery. This is an angiogram image. And you can see where the arrows point, that's where the blood flow is actually stopped by a plaque that's developed behind the kneecap. So the main detrimental effect of this disorder is exercise intolerance. These patients cannot engage in heavy activity, and in fact, very light activity such as walking can become very, very unpleasant for this population. On average, they have a 50% reduction in exercise capacity compared to healthy controls. And this is for three primary reasons. The first is the primary symptom is called claudication, which is pain in the calf that results from an insufficient blood supply to the working muscle during walking. Also, these patients have an exaggerated blood pressure response or pressor reflex during exercise, which limits their ability to exercise. And they have very low levels of cardiovascular fitness, whether and the direction of that is bidirectional. So the current treatments we have involve clinical exercise, clinically supervised exercise, medications, and revascularization surgeries. Supervised exercise is the most effective. However, most patients don't have access to a clinical setting on a regular basis, whether that's for costs or travel reasons. Cilostazol is the primary medication that's given to these patients, and that's shown promise for improving flow. However, the research is very inconsistent on its improvement for practical outcomes in the disease. Revascularization involves typically either a bypass graft with a healthy artery to go around the occlusion, or stenting in the actual artery, which will reintroduce flow to the affected limb. This is only an option for the most severe patients, and there is unfortunately a very high incidence of relapse back into an occlusive state after having this surgery for these populations. So as you can see, we don't have a practical, efficient strategy to treat these patients that are suffering on a daily basis. So we looked for more cost-effective ideas to treat these patients. We looked at heat stress. Heat stress, when applied to the body, causes peripheral vasodilation. So what that means is it causes the arteries to open wider than they were before. This is through nitric oxide, which is a common substance that causes opening of blood vessels. So what we did initially was a study where we had patients have heat treatments applied to their lower limbs, and they just were at rest. And we analyzed blood flow and also vasoconstrictor substances, endothelin-1. So endothelin-1 is a circulating factor that causes blood vessels to close. And that's elevated in this population, which contributes to the disease. What we found was that lower limb heating increased blood flow and reduced endothelin-1 in this population. How we applied this heat stress was through space pants. So the reason that it got this name is because these were originally devised for NASA to be used in astronauts to regulate their body temperature during space travel. We adapted this technology for our own purposes as a very effective transportable way to apply heat to the lower limbs in this population. So our question was, once we discovered that an increased flow, will this increase in blood flow to the limbs improve exercise performance in these patients? Are they able to walk more? Are they able to walk with less pain during exercise if they receive heat treatments before the exercise? So the study design is we have patients come in and they will receive 90 minutes of seated heat treatments with the space pants. They will receive either a 43 degrees Celsius treatment or a 33 degrees Celsius treatment. The 33 is designed to mimic skin temperature, so it's essentially a control condition.
How does that translate to Fahrenheit?
How does it translate to Fahrenheit? Okay, 33 is, so 43 is roughly 108 degrees Fahrenheit. So it gets skin temperature up to 37, which is about 98.6. So we're getting about a 4 to 5 degree increase in skin temperature over the control. So our outcome measures, we're looking at peak walking time, which is how long can the patient walk on the treadmill. We're looking at claudication onset time. So this is when the patient reports that they are having calf pain. We're looking at calf muscle oxygenation via near-infrared spectroscopy. So that's a really nice device that's able to quantify indirectly the amount of oxygenated hemoglobin versus deoxygenated hemoglobin through infrared light impedance. We're also looking at our plasma endothelin-1 levels and our blood pressure during exercise. So that's a picture of the NIRS. It's about the size of, it's about a matchbox, and it goes onto their calf and emits lights into their, infrared light into their calf during exercise. Here's our exercise lab at IU Health Methodist, Indianapolis. That's where we do all of our exercise testing. That's actually the same treadmill they use for the NFL Combine. So our patients like to think that they're athletes. Our preliminary findings, and this is only after 6 patients have completed this, but the findings look promising. Peak walking time was increased by 7.28% amongst patients who are in the heating treatment versus the control. We also saw a decrease in calf deoxygenation, so the amount of deoxygenated hemoglobin is lowered. Also, endothelin-1 levels and blood pressure were lowered during exercise in this population. And these patients serve as their own control. So we don't have to match the patient against anyone else. These patients are undergoing both of these treatments. And we can see here, this first graph is showing calf muscle deoxygenation during stages of exercise testing. We have each stage is 2 minutes, represents an increase in 2% grade on the treadmill. So we have the first 3 stages, also when the patients reported claudication and their peak walking. And you can see based on this graph that we have a nice trend for decreased deoxygenation. We have the control is the dark and the heat is the white. But we have at all stages, including maximal exercise, less deoxygenation of the calf. And this is endothelin-1 levels, which we saw confirmed our previous research, but showed a decrease after heating compared to the control, so less constriction of the blood vessels. This is a novel finding here that even at rest during heat treatment, we had a reduction in blood pressure, mean arterial pressure here, at all time points. So they undergo 90 minutes of heating, and their blood pressure is actually lower at every time point during the treatment. And our last trend we saw here, we have during exercise, the pressor reflex is blunted. So we have less elevation in blood pressure at every single stage and at rest during exercise when they undergo heat treatments versus control treatment before exercise. So our future directions we want to go with this, we have promising results with this. We still have 10 more patients to analyze for the data set. But in addition to this, we have an NIH-funded trial right now that involves the patients taking the pants home and wearing them for 90 minutes every single day. After that, at which point we'll measure every 4 weeks different outcome measures to see what the long-term effects of regular heat treatments have. We also hope to analyze what effect this has on revascularization recovery. We know the recovery is not good once they have a surgery to improve the stenosis in their leg. So our heat treatments and restoration of flow able to improve this recovery. And truly the best next step for us is, can the patients wear the pants while they exercise? That would be truly the most efficient way to improve exercise if it does, is can they wear the pants while they're on the treadmill or while they're going about their daily activities to improve their ability to ambulate? So there's some references in my contact. Thank you for your time, and I think we can open it up for questions.
I don't think Out of curiosity, how much are space pants?
How much do they cost?
Yeah.
It's really dependent on the supplier and what specifications we have. I'm not sure I can actually answer that question. So.
My question, the change in blood pressure makes sense to me because of vasodilation, but I wonder if you have any thoughts about the mechanism for the reduction in endothelin-1.
So prior research has shown that heat stress increases nitric oxide levels, and we know that nitric oxide displaces endothelin-1 off the receptor. So we think that it's likely a nitric oxide dependent reaction, that it's just by more nitric oxide we have less endothelin-1.
Yes, I'm with Livia, but my question is, how much do they weigh?
They're very
So-
light. They're very lightweight.
So they really wouldn't interfere with exercise?
Well, the only problem is they're attached to a pump. It's a
How heavy is the pump, maybe?
the pump is a few pounds, but it's full of water. So right now the technology needs to advance a little bit more to make them more portable. Like if someone was,
Like a little backpack in your
yeah,
pants
right
or
now it's not to the point where you could walk around very easily with this thing.
Okay.
So that's our research is in the preliminary stage. But the pants themselves weigh very little. It's just a latex pant with a tubing coil that runs through it.
And it's flexible enough that, for example, when you're talking about, excuse me, older people who may be older and somewhat impaired in terms of their ability to get them on, that's
Yeah, they
doable
actually
as well.
zip up the sides. It's very easy to get on,
Cool.
even for the
Okay, thank
aging
you.
population. Yeah.
I was wondering, do you see a decline in performance as the body cools? Like say you're heating them up for 90 whole minutes, but don't they start to return to their normal body temperature quickly?
That's not something we've looked at directly, but the exercise testing is immediately after heating. So they're heated, and immediately, we even fit them for the apparatus for the treadmill test while they're still being heated, and then they're immediately taken to the exercise room. So in theory, yeah, it could have a small effect, and that's why I say that wearing the pants would truly be the best modality. But right now, the gap in time is only a minute or two.
But what if they exercise for 20 minutes? At 20 minutes, wouldn't they be not as warmed up as they would be at?
It could be. I mean, their
2 minutes?
temperature rises greatly during exercise, regardless.
Oh, good
Right.
point.
So
Okay.
it's gonna go up to a standardized fashion during exercise, but we want to prime the body with increased blood flow to perform better during the exercise.
Okay, thank you.
We have time for one more question.
Something I'm wondering about is how this translates into pain. Do you have measures of whether their pain decreases or?
So our measure of pain is claudication onset time. So that, in theory, would represent when a measure of pain. So the patient says, my calf's starting to hurt while they're walking on the treadmill. But what we found is this is a fairly unreliable measure that's dependent on the day, right? I didn't sleep well last night, so it's going to be closer to the front. We have a lot of variance in that data. So that's the measure of pain we have, and it still is up to the rest of the data set to find out if that's actually having an effect there. So. Thank you.
Okay. Thank you very much, Jacob.